East Tennessee State University Bill Gatton College of Pharmacy is stepping up to the plate during the pandemic, filling an urgent need in our community. They are making and distributing hand sanitizer. Joining me this morning with more is Dr. Charles Collins, professor of Pharmaceutical Sciences. And Dr. Collins, thanks so much for joining us.
Thank you for having me. It's a pleasure.
Well, this is certainly very exciting. We know, we have seen the empty store shelves. We know how important this is. Tell me how this got started with you guys.
Well, I was inquired by some of my colleagues if we could make some hand sanitizer. And looking at the official formulas that the CDC and the USP had put out, one of the main ingredients was hydrogen peroxide, which you can't get, and it's not something that I normally used in my lab. But after thinking about it for a little while and reading about it, it seems the hydrogen peroxide was in there as a product preservative. I had an alternative preservative I very often use in my lab, benzalkonium chloride, quite a good stock of it. So with the other two ingredients, the alcohol and glycerin, which I normally have, I could make a hand sanitizer.
Incredible ingenuity there, and also what a great way to turn that into a teaching moment as well.
Yes, my intention is to incorporate this into our teaching labs and teach our students how to make this, so should something like this occur again, our students that would be out in practice would be able to make it. I would advise them to keep a little stock on hand, and that way they could make it at need.
And Dr. Collins, tell me a little bit about where you are now in that process right now. Have you distributed some already?
I have distributed about 15 gallons or so to the College of Medicine, which we partnered with first. I have gotten some inquiries from other places that want a quantity of it. I still have material to make about 28 more gallons, and I'm trying to get some more. So up to this point, I'll have about 10 gallons that's not already spoken for, and I'm in the process of distributing that to first responders and hospitals and clinics and those types of things.
What has the response been so far as you put out the word, first of all, that you're making this hand sanitizer, but secondly, that you found a different way to make it despite the shortage?
Well, certainly people are interested in obtaining it, and again, I've found a way to use what I had on hand. That's my expertise is in compounding, so I utilize those skills in order to come up with this particular formulation.
And it seems like, too, really goes right along with your mission, and that is to always be sort of supporting our own and the rural environments that we're seeing. It's kind of quite a parallel.
Yes, I did clear with my department chair and my dean that, in my opinion, I thought we should just make it and give it away, and they were completely on board with that, completely supportive of that, and that goes along with supporting health in this region and in this country in general.
Yeah, absolutely. Well, thank you so much for what you're doing. Is there a way our viewers, if they have that need or want to get in touch with you, what's the best way to do that?
My email address at the College of Pharmacy is collincc at etsu.edu. So they would do that. At this juncture, I'm not really set up to hand it out to individuals. It's more to healthcare institutions and first responders.
Absolutely. Getting that need on the front lines. Dr. Collins, thank you so much for taking the time to talk with us today. Thank you for what you're doing here in our community.
Oh, you're very welcome. It's my pleasure to help. That's one of the reasons I got into healthcare.
All right. Well, stay well. Thank you so much.
As well as you and the audience too.
All right, we'll give everybody again that website. If you would like more information, you can always contact him through this website.